Hello everyone, and thank you for joining us today. My name is Dawn Montroy, and I am the Clinical Director at Blossom Behavioral Wellness Center located in Novi, Michigan. We are a behavioral wellness clinic that focuses on early intervention for children and families with developmental disabilities. Our center offers applied behavior analysis, speech and language therapy, occupational therapy, counseling, and art therapy in one convenient location. Our team is highly collaborative and discuss any and all treatment decisions and outcomes as a team, which allows us to provide your child and family with the most effective therapy possible. We are really proud to say that our facility offers classroom-based programs that emulate a naturalistic preschool-style program so that your child can learn in the most naturalistic setting possible. Our facility boasts classrooms, a full gym, sensory room, indoor playground, as well as mock community spaces where we can practice things such as going to a restaurant, the doctor's office, the hair salon, and allow your child to experience the natural world in a therapeutic setting so that we can prepare them for outings in the community and daily life outside of these walls. Is highly qualified and are eager to work with any of the families that come through our doors. We would love to have you for a tour at any time. You can reach out to us at our website or via email. Our website is blossombehavioral.org. So today we come to you with some information about one of our therapy options that we offer here, art therapy. And our licensed counselor and registered art therapist is going to talk to you today about how we move beyond coloring and into art and therapy specifically related to autism spectrum disorder. Her name is Elizabeth Webster, and I'm so happy that you get to hear from her today. Thank you for joining us, and we hope you enjoy this presentation.
Hi, my name is Elizabeth Webster. I'm a licensed professional counselor and a registered art therapist. Today I'll be discussing what art therapy is, who is an art therapist, what we may do in different sessions across the lifespan, and what some of our goals may be in a therapy session, especially with those who have been impacted by autism. So when we say that art therapy is an integrative mental health and human services profession, that means that an art therapist has a background and education and supervision when in training to provide a therapeutic service with their clients. We'll provide theory background and developmental background that we've learned, as well as knowing different specific types of art media that would be the best way to use for different scenarios. As an art therapist, we've been trained also to learn that certain materials might elicit different emotions, whereas others might also elicit some background feelings and thoughts that maybe we haven't processed before. So basically, I'm there to help kind of guide and support my clients, and I'm not the person that's going to say, hey, this means that because it looks like a certain thing. So what art therapy is, there's two different ways that we can look about it. In art therapy, we can go about it in two different ways. There's art as therapy, which means we're using the art making activities as the therapeutic tool toward the process of healing, clearing the mind, and self-expression. That means the idea of creating is the therapeutic element, whereas art psychotherapy might be that we're using art as the form of expressive therapy, but the idea that the art is a vehicle for symbolic communication, meaning I'm creating something in response to something because it means something to me, and I'm going to make it in a less invasive way so that way I can express myself. It's important to know that an art therapist is a master's level clinician that has been trained in developmental theory, psychological theories, and the art making process. Artistic talent is not required to be an art therapist and to participate in art therapy. That is something that I get asked quite often. I happen to be someone that some may say I'm artistically inclined. I have a bachelor's in fine arts. So it actually was difficult for me to kind of change my mindset when it came to going into graduate school and kind of unlearning, like, hey, I'm creating things to be pretty, because that's not what art therapy is. It's about the process, not the product. So when I have clients that come in and they're like, I can't draw anything, or they feel very intimidated because they think I'm going to judge, when it's not the case at all, I like to try to encourage them. It's the most intimidating thing is to have a blank piece of paper or a giant blank canvas. So maybe we're going to throw paint on it, literally, or we're going to scribble. We're going to start easily. We're going to do things that maybe seem silly and you wonder why, what are we doing this for? But the idea is you're going to get comfortable with materials. And this is from any age. So whether I'm working with a little kid who can't talk, but they can hold a crayon and they can scribble, that's them exposing themselves to the creative process. They're visually seeing what they're making, and they're holding a new material. Same thing when we get older. I might get you a crayon. I might get you a colored pencil. I might get you a marker. But the idea is, hey, we still got this blank thing in front of us. What do we do? So, no, you don't need to be an artist. Life is messy. Sometimes life is ugly at times. But the idea is we need to process some of that stuff, and sometimes the stuff on our paper is not gonna look too nice, but hey, our feelings sometimes don't feel very nice either. And that's the reason why we do art therapy, is to get it out. So places that you can find art therapy right now, you can find it in residential clinics. You can find it in hospital settings, outpatient clinics. You can also find it in centers that are helping with those with traumatic brain injury, trauma, and also developmental disabilities as well. The American Art Therapy Association was founded in 1969, and I happened to graduate from the Wayne State University program that offered its first classes in 1982. So when we're thinking of autism and art, we're thinking of having people have the ability to learn in a both visual and an appealing way. And we're also trying to figure out a way that we can get both sides of our brains talking to each other regulate ourselves and feel comfortable, as well as building up that confidence for self-expression. And when we're thinking of it in that way, we're thinking it of art is the most basic way of communication. It is a natural way to communicate since we're little, and throughout life we might learn different ways that, hey, we're not going to create anymore because I'm not good at it, or we don't have the means necessary to get art supplies, and art isn't in a lot of schools anymore. So being able to have that ability to go somewhere and create different things in a safe way, and being told that we're not doing anything wrong, might build up our confidence and might help us figure out different ways to make things feel a little bit easier on ourselves. So when we're thinking of the criteria for an autism spectrum disorder diagnosis, there's usually a few different things to meet the criteria. There's deficits in social communication and interaction and social skills, deficits in nonverbal communication and just communication in general, and restrictive or repetitive patterns of behavior, as well as rigidity in schedules, changes in routines, clothing, and some foods. So if we were to compare some of the things that, let's say, define what autism spectrum disorder diagnosis could be, but we know that it's different for every single person, and sometimes the deficits can actually be a really good strength to build on when it comes to therapy. It's a good way to kind of look at how art therapy kind of treats those specific things. So an art therapy treatment specific goals could be working on imagination and abstract thinking, sensory regulation and integration, emotions and self-expression, communication and social skills, developmental growth, visual spatial skills, and recreation and leisure skills. So if those are the goals for art therapy, and then those are the, let's say, deficits in the criteria to get a diagnosis for autism, I mean, those seem like they would to go hand in hand. So it's just a matter of trying to figure out, hey, what makes sense for this individual? Because we know every single person is unique. Every single person has different likes and dislikes. So trying to figure out and integrate different things to kind of meet where our client's at is especially important when it comes to art therapy. I think it's important to talk about how our brain plays a role in the creative process, in art therapy in general, in developmental progress, and also how it impacts those on the autism spectrum disorder spectrum. I want to talk a little bit about just our brain development and how our brain kind of communicates on each side. So if autism is a pervasive rewiring of the brain, I'd like you to also kind of think about how our brain is also impacted when we are overwhelmed with feelings and emotions and something that's called maybe a traumatic event. So when we experience trauma, it rewires our brain. That is somewhat similar to some of the emotional responses and sensory overload that you may see for those on the spectrum. That means it's difficult for each side of the brain to kind of communicate with each other, and it's difficult for one to kind of, take over when the other one is just on a frenzy. So for instance, if we are super emotional and we're super dysregulated and we're just having a meltdown at that point, it's kind of hard to think logical at that point, right? So if we think about the two sides of our brain, we've got our left side and we got our right side. Really, if you think about it, each side of our brain controls the opposite side of our body. So if we have issues with coordination and movement and stability, then we want to use ways that can kind of use both sides of our brain. So we might do things with our occupational therapist to kind of reach over in different ways, so then we can feel like, hey, we're getting more comfortable and we're firing different parts of our brain to communicate with each other. So the way that our brain works, we have our right side of the brain. Our right side of the brain communicates to our entire left side of the body. And then we also have the left side of the brain that controls the whole right side of the body. So when we're working in art therapy, we're going to try to do things that might incorporate both sides of the body with movement to get the communication of our brain, different hemispheres to kind of talk to each other. That's going to help ease those intense emotions, maybe ease those intrusive thoughts. So if we're thinking about a right-brained person, that's someone that probably is super creative, might be very empathetic, sensitive, and enjoys having a big imagination. Whereas the left side of the brain is going to be usually someone that is very detail oriented, likes the facts, likes numbers, loves math, loves order and routine. So when you're hearing some of the trademarks when it comes to autism, you kind of think about some of the things that are on the left side of the brain. So when I was talking about using deficits as a strength, think about it as art is an activity in which strengths, such as if you're a visual learner and you love sensory seeking interests, such as touching things and smelling things, and then you might have a deficit in imagination and needs for controlling sensory. That's what art is. That's what art therapy is. We merge those two together. So when I'm working with kids that are repulsed by, touch, different sticky things, but yet they really like the smell of something, I might be able to have them utilize that visual learning and the smells in a paint to get them to kind of be enticed to touch all of it together. And it's using that motivation and that positive reinforcement, saying like, yeah, we're touching that, we're playing with that, we're painting, we're doing something that might be something you would have never thought of doing a couple weeks ago, but it's in a way that's a much more safe and learned environment that makes the kids, let's say the younger kids, feel like they're in a way that they can kind of truly express themselves in a way that kind of builds up their self-esteem because they're visually learning and they're seeing things that they're making. So specific ways that art therapy can be beneficial for those with autism, and then integrating ABA techniques. Think of it as we can program stimulus changes prior to the problem behavior to kind of reduce the likelihood of that problem behavior. So if I know that someone really, really hates painting, I might offer two different types of paint. I might offer acrylic paint in a jar, or I might offer, hey, I have these markers that look like paintbrushes. So that way they can choose their preferred activity and I'm offering them choices and altering the presentation of instruction, but I'm also enriching the environment to give them that sensory stimulation, as well as kind of reducing that problem behavior, saying like, hey, nope, I don't want anything to do with any of that art supplies. And going on to positive reinforcement. So if a kid really didn't want to do anything, I'm going to meet them where they're at. I'm going to still have the supplies out, but if they're going to go and at least touch it and kind of revisit it, I'm going to praise that. I'm going to say, hey, that's a great job. So we talked about how psychiatrists and other professions may use drawing to check out developmental milestones and cognitive capabilities. So one of the developmental stages that I kind of look for when it comes to art is developmental stages in drawing. The first stage that we see in drawing and using materials is scribbling. So scribbling is going to look like there is just a bunch of lines all over the place, lots of zigzags, and this is quite normal. The only time that it gets concerning is if we're still in the scribble stage when we're quite older. The second stage looks like scribble stage, but we're going to have appearance of much more round or bigger shapes alongside the scribbling. This is going to get us more movement, kind of incorporating both sides of our brain again, and just being able to experience that, hey, we're seeing this visual field, I am making a mark that kind of looks different. The third stage is when you can identify things that they know in the world, and they say that it's creating a resemblance of something. You might see a scribbled shape, but to them, hey, that's a cat. Hey, that's me. So when we get to that part, that's the idea that we're using our imagination, that we're able to use symbolism in our drawings. The fourth stage usually is around 4 years old, and that's when faces and people appear. And when I say people with quotations, I mean we might have a round scribble with arms and legs coming directly out of the head, but that's okay. That's giving, your child that capability that they are making faces and that they are kind of associating that they are creating something that looks like things, or at least that they're trying to do that. The fifth stage is right around when we're 6 years old, and that's when we start using kind of like a baseline on the end of our paper. That's kind of where the grass is. That's when pictures start to sit on, a landscape where there's maybe a house, families, cars, bikes, something that's symbolic. So a lot of kids will draw things with like houses and trees, and there's a sun, and there's a person standing on there. So it's a very kind of generic picture, but it's something that is huge and monumental in the developmental stage when it comes to drawing and symbolism and using your imagination. Now, the sixth stage kind of comes around between 8 and 10 years old, and that's when scale and perspective matter to usually the artist, the person drawing. And when I say scale and perspective, I mean you're going to draw a house, and then the person that's next to the house is smaller because a house isn't the same size as a person. It also means that you might be able to have a different kind of viewpoint, and something might look closer in one side than the other. So this is a lot harder and less spontaneous, but for kiddos that do enjoy art and are able to master these kind of things, chances are they're going to continue drawing. But the problem is, right when we're around 10 years old and right around when we reach adolescence, we become so much more aware, usually, and much more interested in our self-esteem and what other people think of us. So around this age is usually when we start hearing people say, I'm not good at art, or that doesn't look like that, and we might think poorly about what we've been doing this entire time and stop creating. So it's kind of sad. We want to encourage our kids to continue making art. We want them to continue, playing around, because in reality, it's helping us express ourselves. It's helping us, release some of, build up, and maybe keeping our anxious hands busy as well. And we can always learn those things like skill and perspective if we want to continue drawing because it's fun for us. Drawing for the sake of drawing, creating for the sake of creating is extremely important. But we also do look at the developmental stages in drawings to know kind of where we are on the cognitive level when we're working with kids, especially on the spectrum, and with others that may have traumatic brain injuries or some sort of developmental delay. So when we're addressing sensory issues, art therapy is used to kind of introduce a variety of new sensory experiences. So for example, finger paints, temperatures. And when I say temperatures, I mean I might use really cold water. We might paint with ice cubes. We might use like a heating pad or warm beans or something, dried beans, to, paint or make a warm, bean bag of some sort. Textures and fabrics is also something that's extremely important. Lots of people come in here and they kind of address their concerns about kids wearing certain clothes, and they don't like wearing certain clothes. So I might have different kind of fabrics that are cut up, so we can use those to touch and kind of, gradually expose ourselves to that feeling and get used to it, right? Because the idea is we want that exposure because we can't escape some of these things in our everyday lives, but we're making it in a way that is comfortable and in a way that is safe. Another thing is colors. Some colors are just very, very vibrant to some people and they hurt our eyes. So being able to expose different colors and different ways that we can mix the colors, and I've talked about smells before, adding smells to the colors is a great idea as well. It addresses sensory issues, and we might use all of them at once depending on our client, or we might do one at a time if it's a young infant or someone that is extremely dysregulated because something is super overwhelming. I think it's super important to understand that using art in art therapy and in counseling sessions is important for any age, but also play is super important as well. So if I'm using clay and I'm using a favorite toy car, I may also use the toy car over the clay to make different patterns and make marks, so then the kid has a transitional item that they can like. Some kids love cars and the wheels, so being able to kind of understand that I am putting the car over the clay and I am making these tire tracks. Those kind of things can create more play, social skills, sensory skills, and it might encourage them to also play with other kids as well because they're noticing different stuff. These kind of things can be used if you're also outside in your backyard and in the dirt, kind of noticing the different patterns that, your toy cars may be making as well. But we want to incorporate different ways that kids can enjoy it as well as benefit something from. As long as a kid can manipulate materials, can hold something, they can get the benefits from art therapy. And those are going to be the ideas that our brain from 3 years and below is predominantly governed by the right brain. So creativity is so natural to them, that's their way of expressing themselves. So a possible goal for art therapy when I'm working with those in early intervention are going to be kids that are working on developmental milestones, those working on fine motor skills, picking up different things with the pieces, their little tiny fingers, maybe ripping up things. Maybe just the idea that they're going to touch something that's different and, ooh, I didn't like that. But give them that whole experience that they can actually react and start regulating their emotions at a very young age. Some of my favorite materials that I use for kiddos that are from a really young age and early intervention up into 3 and even partly through childhood would include things like Model Magic. So Model Magic is specifically a brand from Crayola. It's a non-toxic air dry modeling clay. It comes in a few different colors. So for instance, this one's yellow. And the idea is we're getting kids to touch something that feels a little different. We're going to talk about, hey, this is soft right here. We are pulling, we are breaking, we are ripping. Sometimes we'll even add different elements to it, such as I'll add a little bit of a safe essential oil or something else with a scent that is non-toxic for kids. Because let's remember, when it's early intervention, we need everything to be taste safe, because we learn through our senses. We might put things on our mouth, we might put things on our nose, we might just put it all over ourselves. And the idea is we want them to get exposed for different things. So Model Magic comes in a few different colors, and the idea is we want them to get exposed to different things. I'm not expecting kids to be making masterpieces. I'm not expecting them to really make much of anything right now. It's just the idea that they are touching things and making new things. So for instance, this is actually a piece of Model Magic that I used with another one of my clients that I believe he's right around 2 years old. I gave him blue and I gave him yellow. You put a little bit of blue in the yellow, and then we notice at this point it's mixing a little bit. So what we would do is talk about we're making green, and we would also narrate it. We are mixing green. We are mixing yellow and blue to make green. And a lot of the things is we're using communication. We are allowing the kids to kind of know why we're doing it, what we're doing, what I'm experiencing, and maybe hopefully they can start kind of understanding and relating, like, hey, this is soft, this is yellow, this is blue, we're making green. And over time, the more and more we kind of do these behaviors and experiences, kiddos will kind of relate to the different things. They will be able to say what color. They can be able to, associate and, get that gradual exposure of the touch of the different weird kind of sensory items and be like, hey, kind of like that feeling. I'm used to that feeling. Another thing to notice is I did add a little bit of essential oil in here, so it does have a smell of orange to it. So some of the kids who are a little bit repulsed by touching things and kind of a little nervous about it, if I add a little bit of smell to it, that actually might give them another kind of, I'm gonna kind of be more interested in it. I want to kind of discover it. I want to touch it. I want to know what that's about because it smells a little funky. I might like that smell. I'm not expecting kids to be making masterpieces. I'm not expecting them to really make much of anything right now. It's just the idea that they are touching things and making new things. So for instance, this is actually a piece of Model Magic that I used with another one of my clients that I believe he's right around 2 years old. I gave him blue and I gave him yellow. You put a little bit of blue in the yellow, and then we notice at this point it's mixing a little bit. So what we would do is talk about we're making green, and we would also narrate it. We are mixing green. We are mixing yellow and blue to make green. And a lot of the things is we're using communication. we are allowing the kids to kind of know why we're doing it, what we're doing, what I'm experiencing, and maybe hopefully they can start kind of understanding and relating like, hey, this is soft, this is yellow, this is blue, we're making green. And over time, the more and more we kind of do these behaviors and experiences, kiddos will kind of relate to the different things. They will be able to say what color. They can be able to, associate and, get that gradual exposure of the touch of the different weird kind of sensory items and be like, hey, I kind of like that feeling. I'm used to that feeling. For childhood, we consider that the age is from 4 to 10 years old. Possible goals for art therapy would include still addressing developmental concerns and milestones, fine motor skills, regulating emotions, identifying emotions, and dealing with maybe sensory and regulating emotions, as such as creating imagination or improving our imagination skills. So when we're a child and we're experiencing all sorts of different things, it's kind of hard to express ourselves. It can be, right? At any age, at any developmental capability, from ages 4 to 10, that's a huge difference from 4 years old to 10 years old. When we tell kids that, hey, they're not allowed to feel a certain way and that they should not be worried about something or they should just do it, we're kind of being invalidating at times. So in the art therapy world, we're going to be using art as a way to build up their self-esteem and confidence, help them kind of use it to express themselves in a positive way that isn't using words that are super hard to find. And we might also use it as a way to help recognize and respond to facial cues. So if I'm doing something with a child that might have a hard time reading facial cues, we might practice mindfulness and awareness in the idea of, when I'm angry, I look like this. When I'm happy, I look like this. When I'm sad, I might cry. And it might be really hard to visually draw that or paint that. So we might use things like stickers. We might also use picture clippings from collages and magazines. We might also find more taste-safe materials because, hey, we still like to taste and smell different things. So another thing we can use if kiddos are having issues with fine motor skills is things called dapper dots. And these are very simple to make. 2 eyes, a nose, and then you can swipe it across to make a mouth. But it's large enough that a little hand can wrap all the way around it. So, some art materials that I like for kiddos that are either an early intervention in childhood too, and I want to get them exposed to painting and just using kind of more fluid materials. I know it's going to get messy at times. That's just part of being an art therapist. Also know that if you have a child, you probably know things get messy quite easily, quite often. So I have these non-spillable paint containers. They say non-spillable, sometimes they will spill. But the idea is it's not a full opened container so that when I open it, it's just paint. So what we would do is, a kiddo that I've been working with will say, open, and I would say, open red. I might also give an option and say green or red, and I will talk in, short sentences in ways that they can easily identify different things. Now, obviously, if I'm working with a kiddo that is a little bit older and a little bit more verbal and they know what they're doing, hey, we're gonna talk. We're gonna be saying different things, and that's totally fine. That's awesome. So another thing is I like to water down my paint. Easier to clean, and we also might be able to be less repulsed by it because it's more fluid. I might also add a little scent to it too. So for instance, this one might have a little bit of a peppermint smell to it. I've had kids who legitimately did not want anything to do with a paintbrush. So what we'll do is we'll start with like a watercolor tray, the ones that you get from an art class that have the little like 4 colors in it and the tiny little paintbrush. But the idea is for them to get exposed to different things. So if I have a paintbrush, what I could do is have a kid have a paintbrush and have water. Just the idea of them getting the experience of dipping the paintbrush in the water is a good first step. So having them have that confidence that they can do that, and then do the next step of dip in water, dip in paint, put on paper, brush on paper. We are painting. These are the techniques that we can do. And as we're doing this in different art therapy interventions, you'll notice that kids will experience this thing called flow. So when I say flow, I'm talking about we are immersed in the creative experience. In art therapy, flow is the idea that we are in the process of therapeutic art making. And that is on any age, that is at any level, that we are in that healing process. We are in the zone. People can experience flow in different things. But for instance, this is art. So if a kid is experimenting with different paints, what they might do is they might just casually dip the brush in the paint and then put it on the paper just to see what it looks like. So then we'll start noticing how they play with the different colors. We might eventually add more colors because we don't want to give them so many options and then they can't make these decisions. But we also want to give them an opportunity that they can express themselves and have the freedom of choice as they please to pick different colors. Another material that I do like for kiddos that are in early intervention or childhood, so childhood would be ages from 4 to 10, would be dapper dots. So kiddos that have problems with fine motor skills, so holding a pencil or anything, might have an easier time grasping onto a dapper dot. So a dapper dot is actually really what you consider those bingo dot markers that got a round tip to it. So pretty easy to kind of stamp and make marks on a piece of paper. Kids love these. Adolescent and teens. This is an age group from 11 years to 18 years old, and it's a pretty diverse age group. To me, this is a very vulnerable age group. We're trying to figure out who we are, and our bodies are changing, and self-esteem and just awareness really kind of opens up during this time. And it's a challenge too, because when we have our brains still developing and that frontal lobe, the very front, we like to say that's our executive functioning. I like to say that that's like our secretary of our lives. It helps organize things, it helps plan things, helps kind of make sense of things. And if we don't have that fully developed, but yet everything else is, and we start looking like we're an adult, it's really, really kind of hard to kind of distinguish, hey, where is my role in life right now? So self-esteem is a really big thing that we want to work on when it comes to adolescents and teenagers. No doubt that self-esteem is something from across the board that can help, or it can be something that we want to address in counseling and our therapy sessions. But teenagers especially is something that we want to work on, is self-esteem, communication, assertiveness, confidence, and then having that social skills so that way you can communicate some of these maybe things that are bothering you as well. So as I said before, responding to and recognizing facial expressions is an extremely important thing that we would love our clients to learn that are on the spectrum. So an intervention that I may use for art therapy is creating self-portraits or creating a portrait of someone else that you may know. It's a great way to promote self-awareness, and it's a great way to kind of process facial expressions. So if we're doing self-portraits, I often like to have a mirror. I think mirrors are extremely useful at any age if we're trying to learn appropriate social skills and facial recognition. When we're practicing portraits of other people, we're also practicing interacting and processing faces with other people. So it helps work on relationships as well as understanding yourself and others. And it also may help you kind of learn your personal space as well. How easy was it for you as a child or as an adult to express some really hard feelings or talk about some pretty upsetting events, especially with someone you don't know very well? Obviously, I want to build rapport with my clients, but even if I've been working with someone for a long time, or even if I'm very close to someone in my personal life, sometimes it's really hard to articulate some of those feelings, let alone being with someone that maybe have trouble with, being verbal in general. So drawings are less threatening, and it's an alternative to verbal communication. This provides one of the few ways to externalize some of the events that might otherwise be too painful to disclose. It also is telling without really telling. And that's really what art therapy is about, is being able to express things without feeling like you have to explicitly say what it means. Some of my favorite interventions and art materials for kiddos that are teenagers and almost young adults are things that are collages, related to collages. So I like to have magazine clippings set aside that include all different kinds of words, all different kinds of people, activities, food, leisure things, something that's going to be very diverse, so then all sorts of clients that I work with can identify and find things that maybe they're looking for. A way that I can use this is just making a collage that can kind of be a less invasive way to talk about yourself. So an intervention could be, hey, show me a collage of yourself and your future and your goals. So people like to talk about vision boards. So a vision board would be something that a kid could make, and they could put, things that they do love, things that they want to work towards, things that they can identify with. And it's a really easier way to do it without having to draw in color because they're worried about their artistic talent. Because art therapy doesn't mean that you have to be artistically talented. It just means that you want to express yourself in a different way, and you are creative. Everyone can be creative. Another thing that I really like doing when I'm starting to work with those on the spectrum that are in the teens is starting to do groups. So group work is extremely important so you can get universality. And universality means that the other people in the group have the same kind of shared experience that you do. And it's very comforting to know that you're not alone in the process. So using an art therapy group is very vital and useful to learn social skills, to learn reasoning skills, to learn and recognize facial cues, and to kind of understand that, hey, it might be safe if I talk about these certain things because other people might relate to it. I might be able to help another person that's in my group. And the way we can do that with art as well is do a different sort of intervention, such as a collage or making a mask. And then at the end of the session, we kind of talk about it for those who are interested and process it and say, hey, I noticed this when I was creating, and this is what I was thinking of, and this is why I did this. From young adulthood to the elderly population, I'm going to say from 19 years on, even though I know that there's a huge difference in mentality and maturity when you come from a 19-year-old through early 20s and then so on, then as we get older, just through life experience. As far as our therapy goes for anyone in this age range, we're probably going to be addressing individual concerns. And what I mean by that is We could still have issues with self-expression, communicating wants and needs, social skills, and really finding ways to kind of relax and practice mindfulness with ourselves and maybe others. As we get older, we also learn that we have different people in our lives. We come across people we might not like, but how do we kind of make relationships with other people? As we get older, unfortunately, we also realize that there's death. So we address bereavement, we address grief and loss, and life transition. Using art as a psychotherapy tool, meaning using it for symbolism, using it for a cathartic experience, for just releasing of emotions, is really the best tool for art therapy at that point. For developmental any delays or disabilities, we're going to kind of go back and kind of revisit some of the same kind of tools and interventions that we would be looking from all ages throughout developmental lifespan. So just being immersed in different senses. And when I'm talking about senses, I'm also talking about sight, hearing, touch, smell, taste, sounds, like all of that. And just like when I said earlier about having a trauma brain and having a brain kind of rewired from autism, it doesn't mean that anything's wrong with us. It just means that we're all different, and we really all different as human beings. And noticing that we might be a little bit more sensitive to different senses, meaning that might be something that comes across our entire life. A lot of grounding techniques that I like to suggest people use, even outside of just art therapy, but just in a counseling session, is utilizing our senses, using smells, using taste, using touch, using what we are hearing. Often I play music, and the idea is we meet our clients where we're at again. We're not talking about, having people make these glorious pieces. It's about expressing ourselves. Are we angry? Maybe we need to rip up all that paper and throw it away. Maybe we need to, pour some water in different cups. Maybe we need to look at the different colors, just express ourselves, or draw circles, repetitive movement, all sorts of different things that we can utilize when you get into the older age range. Doodling for the sake of doodling. I mean, I honestly believe that being creative and just getting your hands busy is just taking off a whole weight of, pressure that maybe you feel like you might need to have in order to, feel comfortable or communicate certain things, especially if you're not comfortable with your therapist. I honestly believe that building genuine rapport and getting to know one another is extremely important to kind of foster a therapeutic relationship at any age. Another intervention that I really like is using masks. So if I were to have a mask and paint the outside and the inside and use ways that portray myself on who do I show to the world, that's how I would decorate the outside of my mask. Whereas the inside of my mask could be who I don't show to the rest of the world, but that's who I feel on the inside. That's definitely a really nice activity and intervention I can do with adolescents and teens all the way through adulthood and the elderly populations. It's appropriate for people who can definitely think abstractly and in metaphors and in a way that they can truly understand what the concept is of your inside and your outside version of yourself if you're using your masks. Thank you for joining us and taking the time to learn more about art therapy across the lifespan beyond the coloring. And I hope you got a lot out of this webinar. And if you have any questions or concerns, to reach out and check us out at blossombehavioral.org. Thank you. Bye.